think botulinum toxins are very safe. Done in safe hands, they absolutely give very good results. I think the main issue sometimes is with the diffusion of the botulinum toxin. So if you put toxin in over the forehead, for example, and you go too low, sometimes it might diffuse into the next muscle zone, and that's when people get a little bit of droopy eyelids. Also, sometimes if you do a lot of the toxin injections in the neck area to treat some of the platysmal bands, if you use a very high amount of botulinum toxin, sometimes they might get a little bit of weakness in the neck area in terms of sitting straight or turning the neck. They might have issues with that, or sometimes it might diffuse, it might affect a little bit the vocal cords, but generally not life-threatening. The concern is largely from the diffusion of the toxin into another muscle group that you didn't want to treat. You would not be able to see immediate results after botulinum toxin injections, but typically they happen very soon. So sometimes between 3 to 5 days, you will start noticing the effects of it. And typically I get patients to come back about a week out or about 1 to 1.5 weeks so that I can tweak the injections at that point of time. So if necessary, I do a top-up at that juncture. If not, then they're all good to go. That's because usually you want to wait for the onset of botulinum toxin, and they range from between 3 to 5 days or so. Botulinum toxins typically last between 4 to 6 months. It really depends on how often you've had it done before and whether you're a quick or slow metabolizer. For example, somebody who's had toxin injections put in quite regularly might sometimes develop antibodies to that. So over some time, it degrades faster and it may only last 4 to 5 months. Another patient, for example, it may last for longer duration, typically about 6 months or maybe a little bit longer than that. Again, it also depends on where the toxin has been put into. So if you put into an area of high muscle movement, somebody who uses the muscle very often will tend to break that down much faster as well. Botulinum toxin injections and filler injections are two completely different classes, and they're very different. Botulinum toxin is really a neuromuscular toxin injection. So what it does is really to control dynamic muscle activity. On the other hand, filler injections usually by and far fall into a category of hyaluronic acid injections. It is used to fill fine lines that you get from static wrinkles. The other common indication for filler injections would be skin hydrating boosters. So typically they're put in the skin in a very, very superficial level. They draw a lot of water, they plump the skin. With filler injections, there's a wide variety. Typically, I classify them as hydrating fillers or volumizing fillers. And then when you talk about toxin, they stand alone. They're really to control sort of frown lines, wrinkle lines where there's a lot of dynamic movement going on. Botulinum toxin injections and filler injections absolutely get degraded over time. So your body will clear them out and they get flushed out from the system. For example, if you use hyaluronic acid injections as part of your filler injections, they are broken down by a naturally occurring enzyme in the body called hyaluronidase, and that really degrades the HA gradually over time. So typically, most filler injections will last between 6 months to up to about 9 months or so, and it's completely cleared out. With botulinum toxin injections, again, they are also degraded by the body, and over a 4 to 6 month period, they are also flushed out from the system. Now, there are some injectables in the filler category that may not be that degradable. For example, if you use something that is based out of calcium hydroxyapatite, or in the old days, sometimes people use collagen injectables, then these are injectables that have a variable duration of longevity, and some of them may not be as easily flushed out from the system.